Welcome to the channel Everyday Life, where we share health knowledge that is close to you, easy to understand, but extremely important in modern life. Today, we will reveal a fact that surprises many people. There are two extremely common diseases that are more dangerous than cancer and are the leading causes of death worldwide, yet they are often overlooked or missed during regular health checkups. If you think cancer is the #1 killer, you may need to change your mind after watching this video. Two diseases more dangerous than cancer but little known. Cancer has long been a nightmare for many people. When mentioning this disease, people often immediately associate it with pain, despair, and death. However, according to data from the World Health Organization, WHO, cancer ranks only behind two silent killers in terms of danger and the number of deaths caused each year. These are cardiovascular diseases and lung diseases. It may sound unfamiliar, but these are two common groups of diseases in daily life. We often see relatives and friends suffering from high blood pressure, heart fatigue, or prolonged cough, shortness of breath, but rarely realize the seriousness of these symptoms. 1. Cardiovascular diseases. The world's #1 killer. According to WHO, cardiovascular diseases are the leading cause of death worldwide, claiming about 17.9 million lives each year, accounting for nearly 1/3 of all deaths. Common diseases in the cardiovascular group include coronary artery disease, causing heart attacks, hypertension, heart failure, arrhythmia, heart valve disease, cardiomyopathy, myocarditis, especially coronary artery disease, a condition causing narrowing or blockage of the coronary arteries supplying blood to the heart, is the main culprit causing acute myocardial infarction, leading to sudden death if not detected and treated promptly. In Vietnam, according to the Ministry of Health, up to 200,000 people die each year from cardiovascular diseases, accounting for about 33% of total deaths, far exceeding the number of deaths from cancer. 2. Lung diseases, the silent and overlooked killer. Equally frightening, lung diseases are also a leading cause of death, with over 8 million deaths annually worldwide. However, sadly, many people still underestimate or ignore the warning signs of this group of diseases. Some common and dangerous lung diseases include chronic obstructive pulmonary disease, COPD, pneumonia, asthma, lung cancer, interstitial lung disease, tuberculosis. Notably, COPD and lung cancer are the two culprits causing the highest number of deaths in this group. In Vietnam alone, more than 25,000 people die each year from chronic obstructive pulmonary disease, a number that surprises many. Why are these two groups of diseases more dangerous than cancer? The reason lies in their prevalence, high mortality rate, and the likelihood of late detection. While cancer is widely discussed and has many screening programs, cardiovascular and lung diseases are often overshadowed in routine health screenings. Some factors causing late detection. Early symptoms are unclear and easily mistaken for common illnesses like fatigue, cough, shortness of breath, mild chest pain. Routine health checkups mainly include basic tests and do not delve into specialized heart and lung examinations. High costs of specialized screening deter many people. Lack of modern equipment at regular medical facilities. Patients' subjective perception, thinking they are young and healthy and cannot have serious diseases. As a result, many cases are only detected too late, when heart or lung function has severely declined, or when the patient suffers a heart attack or acute respiratory failure. Modern lifestyle, the catalyst for cardiovascular and lung diseases. We cannot ignore the modern lifestyle, one of the main causes accelerating the formation and development of these diseases. Air pollution, breathing fine dust, smoke, and toxic gases daily is a silent burden on the lungs. Smoking cigarettes, water pipes, vaping damages lungs and blood vessels, increasing the risk of blockage. Diet high in fats, salt, and sugar, increases blood pressure, blood lipids, and arterial sclerosis. Physical inactivity and prolonged stress causes metabolic disorders, affects the autonomic nervous system, increases the risk of arrhythmia and respiratory failure. Alcohol abuse damages heart muscle and reduces respiratory function. What to do to detect and prevent these diseases early? According to Dr. Matsuoka Yoshinori, one of Japan's renowned doctors in preventive medicine, prevention is better than cure is the golden rule in the fight against cardiovascular and lung diseases. Some expert advice. 1. Do not rely only on general health checkups. Routine health checkups only include basic tests, blood tests, urine tests, general ultrasound, and often cannot detect diseases at an early stage. If you have risk factors, such as smoking, family history of heart or lung diseases, working in polluted environments, you should undergo specialized screening. 2. High-tech screening helps detect early seeds of disease. Medical centers like NeuroJapan have applied comprehensive screening models using modern technology, capable of early detection of up to 22 lifestyle diseases and 14 types of cancer, including many dangerous cardiovascular and lung diseases. With about 120 minutes of examination, you can be consulted by experts, have lung CT scans, respiratory function tests, coronary artery checks, blood pressure and heart rate assessments, and many other indicators. This is an effective way to detect early and plan appropriate prevention and treatment. 3. Lifestyle changes are an indispensable step in prevention. Quit smoking and limit exposure to dust and smoke. Eat plenty of green vegetables, fruits, and foods low in salt and unhealthy fats. Exercise regularly for at least 30 minutes a day. Regularly monitor blood pressure, blood lipids, and blood sugar. Get enough sleep, reduce stress, and avoid overworking. Pay more attention to your heart and lungs. We often focus too much on cancer and forget that the two organs that keep you alive every second, the heart and lungs, can stop working at any time if not properly cared for. The scary thing is they do not warn with severe pain, but silently destroy health until it is too late. Therefore, do not ignore even the smallest signs. Get specialized health checkups and comprehensive screening if possible, especially when you reach middle age or have risk factors. Do not wait until illness knocks on your door to start caring about your health. Act today. Thank you for watching until the end of the video. If you find the content useful, don't forget to click like, share, and subscribe to the Everyday Life channel to receive more valuable information every day. Wishing you good health, peace, and a fulfilling life.